Today we'll talk about some of the common injuries that occur when you play racket games. Common racket games in Singapore include squash, tennis, badminton, and as in a lot of patients do come to see us for injuries associated with such games. They can be pains and aches in their shoulder joint, in the elbow, and they can also complain of problems in the knee joints or ankle. Especially in games that requires a lot of smashing, overhead serves, patients can develop injuries in their shoulder joints. The shoulder joint pains can appear as mild aches over the outer aspect of the shoulder, or it can be pain on overhead lifting of the shoulder. We do expect some aches and pains with sports, but if the pains do not go away after resting for about 3 to 5 days, and if every time the person go back to play the sports and the pain recurs, then I think it is worthwhile to have an injury and a possible injury to that joint ruled out. One way to see the doctor, and what we usually like to do is take a quick history and find out what was the events that caused the problem. So just for example, some of the common shoulder injuries that we see for racket games include rotator cuff, or what we call the shoulder tendon injuries. And these injuries can range from just sprains to impingement. Impingement means that the tendons get crushed, trampled on when one lifts up the shoulder joint. And the worst case scenario, the patient can develop a tear in the tendons. Okay, and such tears shouldn't be left alone. They should be diagnosed and promptly treated, because if you leave such tears alone, they may develop into a more problematic situation, such as a tear of the tendon in the shoulder that cannot be repaired. Racket games also require the person playing to run around the length of the court, and they have to run quickly, sprint, and then suddenly stop, change direction, and they have to dive to return a ball that's going downwards. They have to run backwards when running forward, suddenly change direction and start running backwards across court. So these are the times whereby the knee and the ankle joints can become injured. The knee joint injuries that can occur with such activities include meniscal tears, which is the short absorption cushion in the knee joint becoming torn or injured. It can also be due to a ligament injury, which can be ligament outside the knee, such as the medial collateral ligament, and in these cases the patient feel pain on the inner part of the knee, and if you ask them to kick a ball, they will find that it's painful. It can also be an injury, a more serious injury, to the inside ligaments of the knee, and by this I mean the cruciate ligaments. We have the anterior cruciate ligament, which is more commonly injured, and the less commonly injured ligament, which is the posterior cruciate ligament. Ankle sprains also can occur when you change direction quickly. It tends to happen if the person is tired, or if they have inherent foot problems such as flat foot, or if they are wearing improper shoes, such as not wearing shoes, using slippers to play. Ankle sprains usually will present with acute pain and swelling, and the person will have a bit of pain, will have lots of pain when they walk, limb starts to limp, and the treatment would then be to rest the ankle, elevate the foot, and apply ice. These are first aid treatment. If the injury becomes better over the next 1 to 2 days, nothing serious probably happened. But if it's still painful after a few days, 3 to 4 days, you should seriously consider getting a medical opinion, have an X-ray done to rule out a fracture, and also to make sure that the ankle ligaments are not too badly torn. Sometimes it's too badly torn, they may require further treatment such as surgical treatment. So how to avoid sports injuries when you're playing racket games? First of all, your gear. Make sure you wear proper shoes, make sure that you have a proper court, that the ground is not wet, make sure that you are using, that you're done proper warming up and stretching exercises before you start playing. And try not to continue playing if you're carrying a pre-existing injury or injury that has not been diagnosed or treated, because you risk making it worse. So do play, but play with play responsibly.